We're going to talk about what happens if one breaks a tooth. Now, not talking about the ones at the back, we've already covered that in a previous video, or indeed if we've chipped something or damaged it. There are ways, I think, of dealing with that at home, as long as you've not split it in half. And if you split a tooth in half, and that can create a lot of problems very quickly. But again, we might cover that a little later. Talking here about if we damage a front tooth, so fall off a kitchen chair, catch our teeth on the side, however that might present itself. If you can find the missing bit, great. Keep it, and rather like you would do if you'd lost the tooth in its entirety, store it in some milk, or you can pop it into the corner of your cheek. It is possible to reattach larger sections of missing teeth. The other thing, again, as with all of the things that we've covered before, is try and keep a little history for the dentist when you're going to speak to them, and hopefully you're going to get to see someone very quickly. If there's a little red dot or a little circle that you can see in the middle of the broken tooth, is the tooth bleeding essentially? Can you see the middle bit, the pulp chamber of that tooth? If you can, the tooth is probably going to need to be root treated going forwards into the future. If it isn't, great. That means that the likelihood is, unless the damage, the trauma damage, the blunt force trauma damage was significant enough, is that the tooth may well survive without having to be root treated going forwards. So what we can do now is we're going to store that little section, we're getting in touch with the dentist, and hopefully again get to one of these emergency hubs where it can be reattached. Important thing is, don't lose it. Have a good look around. Has anything got embedded anywhere else? And clearly if there are other trauma damage issues, so there's some bleeding from the lip or similar, then that will also need to be attended to. If it is significant enough, get medical advice, and it may be that you have to go and get that sewn up at a hospital or indeed at another emergency dental hub. But if you've got a little section of the tooth, it looks as if it's intact and integral, and they're clean break lines, which often they are because the enamel on a tooth is crystalline in structure, so often they fracture either horizontally or obliquely, so you can renegotiate that little section back on. It can be reattached, and they do work quite well for the long term. If not, then we try and need to manage the symptoms that you might be having. So again, controlling swelling. So an anti-inflammatory drug is going to be the way forwards here, because it'll just take the swelling down on the side of the tooth. Again, don't have ibuprofen if you're exhibiting COVID-19 symptoms or similar. Once we've done that, then we need to steer away from all of the things that one might imagine. So soft things to eat, nothing spicy to eat, nothing temperature-wise that's too extreme. So nothing too hot, nothing too cold, because of course those will cause expansion and contraction of that middle bit, that nerve of the tooth that we need to try and keep alive and vital. Try and pop, again, a little bit of sensitive toothpaste maybe on the fractured section until somebody can get to see you to try and restore it. There are lots of ways of then restoring it, so again, be reassured, these things can be fixed and get made to look normal once again. You can either use composite resins to do that with composite veneers, or you can use ceramic veneers or ceramic crowns if the damage is more significant. It can be fixed, but again, tough to manage at the time, but try and get some advice as soon as you can, either by phone or by email, or being seen at one of the emergency dental hubs if you've got the section and we think it can be reattached.